We'll now begin an examination of the hair, the skin, and the nails. To begin, examine the general skin, front and back. Note the color, the general pigmentation. Look for any areas of hyper or hypo pigmentation or any abnormal color. Look for any changes in the patient's skin. Also palpate the skin. Note the temperature of the skin. Note any moisture on the skin. See if it's dry, if it's clammy. Note the texture, the thickness of the skin. Look for any swollen areas or edema. Note and check the turgor of the skin. Check for any bruising or vascularity. Check for any piercings, tattoos, abrasions. Do you have any piercings or tattoos? Be sure to check the front and the back, left and right. Also, during the skin assessment, you need to pay attention to the patient's personal hygiene. Does the patient need any education concerning personal hygiene? If you have gloves available, you can use gloves to feel through the patient's hair. Have a seat. Hold this, please. Notice the texture, the distribution of the hair. Also pay attention to any possible disease processes such as lice or infestation. During this part of the assessment, also note any abnormal distributions of hair on the body. During this part of the assessment of the hair, note any lesions on the scalp. Next, we want to examine the body for any lesions on the skin. If any are found, we need to note the color, the shape, the borders of the lesions. Are the borders regular? Are they irregular? Also look at the location, the distribution on the body, and the size of any lesions. A good way to remember how to assess lesions and teach your patient is to use the ABCDE rule. Teach the patient to remember A for asymmetry. Is the lesion asymmetric? B stands for border. Is the border regular or is it irregular? C is for color. Does the lesion have any abnormal color to it? D is for diameter. Is the lesion increasing in size? And then E is for elevation or enlargement. Has the lesion elevated or enlarged in size since the previous examination? In the next part of our examination, we're going to look at the nails. Left hand, please. When looking at the nails, we want to note the shape and the contour of the patient's nails on both hands, left and right. You check the color. Are they pink or dusky? We want to check the capillary refill. Good. Also look for any clubbing of the fingernails. And the final component of the skin, hair, and nail assessment is to teach the patient how to do this themselves for prevention's sake. Teach the patient that they should perform a self-skin assessment monthly. Also review the ABCDE rule with the patient. The ABCD acronym will help them notice any changes themselves. Have the patient perform as if they're looking in a mirror as we instruct them to begin to teach the patient to examine each of their palms first. Check your palms, please. Front and back. The patient should be told to stand fully unclothed in front of a full-size mirror, full-length mirror for best results. Have them examine their forearms. Hold your forearms up in front of the mirror. Teach the patient to pay special attention to each side of their forearms and to be sure and check under their arms as well. Put your arms out. You're looking in the mirror. They're paying attention to any abnormalities. Next, teach the patient to stand in front of the mirror. They're fully unclothed with the arms out, and they'll examine the full length of their body. Hold both arms out. Teach the patient to check their inner arms, their trunk, and their legs as well. Teach them to also turn to the left and examine both sides with their arms held out while looking in the mirror, and then turn to the right also. Teach them to pay special attention to the upper thighs and the buttocks for any lesions. Turn with your back. You can look in the mirror. Next, the patient will hold the handheld mirror. They'll check the back side of their body. Teach them to stand with their back toward the full-length mirror and use a handheld mirror to examine themselves from behind. The patient should also utilize the handheld mirror to examine the scalp for any lesions or irregularities. Finally, the patient will sit in a chair or on a stool, and they'll examine the inside of their thighs, and they'll also examine their toes and their feet. And this is made much simpler by using the handheld mirror. This concludes the examination of the skin, hair, and nails. Thank you.